More adults are wondering if they have autism, but getting a diagnosis later in life can be difficult. Autism is often associated with trouble communicating or a fixation on patterns and topics, but doctors say liking a routine doesn't mean you're autistic. Some traits of autism can go unnoticed until adulthood, while others may have learned how to hide certain behaviors. No two autistic people have the exact same set of symptoms. Autism spectrum disorder is referred to as a spectrum because of the variety of its signs and symptoms and the different impacts and support needs that people may experience. A study published last year in JAMA Network Open showed a more than 400% increase in autism diagnosis among young adults from 2011 to 2022. Earlier, I sat down with Dr. Abhishek Raut, medical director at Appletree Medical Group, to further unpack diagnosing autism in adults.
Right. So there are several common signs that one could see if someone does have autism. Keeping in mind, of course, this is very generalized, and we have individuals with autism but in separate levels as well. So difficulty with social interactions. This might involve trouble understanding social cues, difficulty making or maintaining friendships, and some discomfort during eye contact. We also see communication challenges. So some individuals may have trouble with conversation, might take things very literally, or struggle to understand certain social things like sarcasm or idioms. We do see repetitive behaviors as well. It can include a small preference for routines, repetitive movements. We see sensory sensitivities. Some people may be overly sensitive to certain sounds or lights or textures that can cause a lot of discomfort or distress. And then we also see social anxiety. So many adults will experience anxiety in social situations, which could really be attributable to autism as well.
We also asked Dr. Raut about the difference for diagnosing adults with autism versus diagnosing children and why there has been a sudden rise in adults with autism.
Diagnosing adults with autism, we do have several steps which can be quite different from diagnosing a child. Oftentimes, with an adult, we'll have a period of self reflection, gathering information. Adults will be able to reflect on their life experiences and identify patterns of behavior that might indicate autism. The first step usually is to consult your primary care physician. And then after that conversation, we might send you to a specialist as well. We do have certain assessments that we do, either a psychologist or a neurologist or a psychiatrist. This usually is a comprehensive assessment, which includes interviews, questionnaires, and standardized tests. The specialist will review the developmental history, including any early signs that may have been missed or misunderstood. And finally, we come up with a diagnostic and support plan. The big difference is, diagnosing children often involves observing their interactions with peers and adults, sometimes in structured settings like schools. Whereas adults have the life experience and may have developed some coping mechanisms that can mask autism traits, and sometimes that makes it a bit more challenging. We also focus really on awareness and self-advocacy in adults because we see that adults may be more aware of these challenges and actively seek a diagnosis, where oftentimes children may have to be diagnosed through interactions. It might be a teacher or parents that might be concerned about. We've seen quite a dramatic increase in autism diagnosis, especially among younger adults from 2011 to 2022. And really, when we look at that, I think we can attribute it to a few factors. The biggest factor would really be increased awareness and understanding. Over the past decade, we've had a lot of rise in awareness and understanding about autism and autism spectrum disorder. And that's led many people who now recognize these signs to look for that diagnosis. We do have improved diagnostic criteria, which has evolved with time as well. And really what we're seeing is a better access to healthcare, so improved access to healthcare services, which can make it easier for a diagnosis, but also to look at help. And then finally, I think over the past decade or so, we have seen a very good reduced stigma in autism specifically. And because of that, more people are coming forward and saying, maybe we should look at a potential diagnosis.
We also discussed the importance of destigmatizing autism and the persistent myth that vaccines cause the disorder.
When we look at autism, we have to keep in mind that autism is simply a very different way of experiencing and interacting with the world. And I think it's very important to take away the stigma associated with that there. We often look at autism as with concern and say maybe there's a possibility that they're not going to be able to build these relationships or have good personal growth. But the truth is that is very much untrue. And depending on the severity of autism, we do see significant personal growth and we do see strong relationships. And what we need in order to foster that really is better acceptance and understanding of autism and really having supportive communities. I think we're going to see this myth come back time and time again. It does get traction usually by someone with some level of celebrity status supporting it. And really what we have to do in healthcare is really focus on education and awareness. So providing accurate information about vaccines through trusted sources, that includes healthcare providers and reputable organizations, that's very crucial. I think government and health organizations do have a role to educate the public about the safety and importance of vaccines. And I think we should also encourage fact checking from our patients and our peers. So, really encouraging critical thinking and fact checking will be very helpful to discern critical information from what's misinformation.